Working Key Services. Today our topic is going to be autism. What is autism? Autism is a lifelong neurodevelopment condition that affects the way a person communicates, interacts, and processes the world around them. There are more than 1 in 100 autistic people in Scotland, yet how many of us really know about autism and what it means for those suffering from it? Now, this is about autism. When it comes to South Asian communities, especially British South Asian communities, here in Scotland, the complex issue to be addressed is to bring on board and tackle the taboo subject of autism in the South Asian communities in Edinburgh, where majority of the grassroots community has a vague understanding of it. They either do not accept, do not talk about it, or feel very vulnerable to talk about this. Now, NKS had been working on this issue and outreaching communities. We ran the 6 months project in the past, and where most of our staff went through 8 weeks training for autism, trying to understand and get insight into the issue. We ran 6 months project initially last year, and currently we are running another 6 months project where we are raising awareness in South Asian communities and outreaching and targeting families where there could be issue of autism. The initial project that we ran last year, most of our staff underwent training trying to understand and get insight into what autism is. Now today, the current project that we are running, today we are going to introduce our team, and we are going to talk about, our team is going to talk about the challenges and what the issues are and how we are addressing these issues. Now, we'll start with Nasima. Nasima, would you like to introduce yourself, and then we'll go around introducing each other.
Hello, my name is Nasima Hussain, and I've been working at NKS for about 17, 18 years now. So at the moment I'm working with the long-term health team, and I'm also doing the autism project.
Hi, my name is Rana Chams, and I'm a digital project coordinator at NKS, and I'm also working with the autism project since October.
Hi, I'm Nina. I'm working with long-term health project, specifically with men, and now I'm working on autism.
We have our project coordinator, autism project coordinator, Nazia, who is going to tell us what are some common misconceptions about autism and what are the cultural beliefs or stigmas that surround autism in South Asian communities. Nazia, can you just tell us a bit about that?
For the first common misconceptions are that depending now if you're verbal or non-verbal. So if you're non-verbal, people seem to think you might have mental health issues, and if you've got behavior issues, other people think, there's some mental health issues, the kid's misbehaving, there's something wrong with the child. Rather than addressing that they might have autism, they already start labeling children. And the stigmas are, people are always worried about what other people will think. So people don't like to seek help, and also there's a big denial within our communities. They don't want to accept. So you need to accept to be able to get help. So the stigma is, again, worrying about what other people think and then being in denial and then getting help because we're very concerned about what other people think. And then the behavior-wise, people think there's mental issues. So there's a lot of that. That's why people don't actually come forward.
Yeah, that all this happens because they think it's mental health issue and they don't want to talk about this because they do not understand autism. This is something that is not so commonly understood, not just in South Asian communities, maybe in general as well. Anybody else would like to add anything to these cultural beliefs?
What Nazia said, I totally agree with her analogy, but I'd just like to add, like when we were working with the groups, especially I just came to realize our South Asian community gave importance to a lot of collective cultures, what community thinks, what our whole life is based on community norms, values, and different things. We don't give importance to individual preferences, and if a person has a certain kind of a mental health problem or any disorder, and he goes out, it is looked down upon as, he has gone out of the community guidelines.
Yeah. Yes, that's right, Rana, because when it comes to South Asian communities, Indian subcontinent, we do have we live in collective society where in living in this country, we are ethnic minority communities, we are in minorities and we are quite close knit. But generally, Indian subcontinent, we do live in collective society. Here, I would say the European society is more individualistic society. So that makes a difference. It is cultural belief as well. Anybody, Nasima, you would want to say something about Bangladeshi community?
With the Bangladeshi community, what I'm coming across is there's lack of education on autism. So people don't really know what autism is. So what we are doing at the moment is, through the home visits, is trying to just make them understand what it is. And another thing what's coming across is just accepting the people who probably know, or they're probably being advised from the school that the child can be autistic. Again, that stigma. So due to the stigma, due to people knowing, they don't want to take this forward.
Yeah.
And I think there's another aspect that comes into this as well, religion. Mm-hmm. So sometimes they think, no, it's it's more to do with religion, and they believe in superstitious things like such as the child's been possessed by something. Yeah. So these are things that we're coming across, and we're just thinking, how do we overcome this?
Yes, because you rightly said. So in our communities, the first thing is we don't believe in generally in medicine. We just our first belief is, has somebody done something? Nazar lag gayi hai? Is there somebody is black magics and this and that? All kind of things. It happens, but. Do you think that these cultural factors influence the diagnosis and treatment of autism within South Asian community? I would now ask Nina to come in if you would like to say something about that.
Yes, I think during my working period when I was working on autism, I came across that, first of all, because no awareness in the South Asian community, and due to that, they don't recognize the child condition. If a child is quiet, they say, it's okay, it's natural, or hyperactive, or doesn't talk to anyone, they say, it's okay, nothing wrong, it will go away as he grew up. But which is not the case. And the parents live in guilt sometimes, fear. If they come to know certain age, so they start feeling that, we didn't do anything. We don't know what happened, how we will come across this now. Well, it's too late.
Yes, I mean, it does, because if there is very little understanding of autism, obviously it will affect treatment as well and diagnosis to begin with, because we do not know. I mean, we're talking a lot about children, adults as well. There is autism, and I mean, adults, when it comes to, because our previous project was more about training our staff and talking, networking with other agencies and talking to communities, but this project is so much about adults, raising awareness among families in South Asian communities about autism. And
why I'm saying, when they're children, parents do not recognize the condition.
Yeah. So yes, Nina, that's really a good point, because as a child, when the issue is not recognized or not acknowledged, that's not the word, recognized, obviously as they become adults, the issue becomes more and more deeper, and then it becomes very difficult to diagnose and the treatment. But what I would say is, all this happens because of obviously lack of education, as Nasima said. But do you think how we can educate communities and how accessible are autism resources and support services for South Asian communities?
When it comes to accessing of resources for South Asian communities, and when we were doing visits, and when we talk to the people, we came to know that the biggest challenge that they face is like they are not aware of it. And when even they go to the professional, when they access the support, it's all, whatever information is there, it's in English. So English is not our first language. So there is a problem over there. And even the professional, they use jargons. That is not understandable. So these are the things that they say. And it is even said, like, some of them even said, like, when they are talking to a professional, and when people like us are expressing a problem, they felt some kind of prejudice. As they don't know what our cultural background is. So that is what I felt.
Yeah. Anybody else wants to say anything about that?
So with me, what I found is with one family in particular, I was asked by the mother to go and visit because the son was autistic. The daughter, again, she's been to CAMS a few times, so she's waiting for a diagnosis. So this mother, she's not fully understanding, but she knows her kids are autistic. But what does autism actually mean? She doesn't really know the meaning of it.
Yes, I mean, yes, education is not there, information is not there. Now, there are challenges related to languages, because recently in our current project, they asked us, which languages we would want these to be translated. Yes, because they have limited resources, so the main ones we said are Bengali and Urdu, and we completely ignored the Hindi one because they don't have resources for that. But now because of limited resources, they only gave us 2 options. Now we could, if ideally we could have got it translated in Hindi and Gujarati as well, because that is also in demand. But translating leaflets or information is not the only solution, because of low literacy level among grassroots South Asian communities. So many of them can't read and write their own language as well. So these are the barriers. But what are the family dynamics within the family, or what is the support network within South Asian community? Let's talk about first about family dynamics. Nina wanted to say something about family dynamics. Would you like to?
Yeah. During this period, working period, I came across that the mothers are very controlling to their grown-up kids. Maybe due to habits they got, due to fear, or because the adults themselves confined enough that they want to do something on their own. I mean, they don't like to be controlled all the time in all their decision making. So this is a very, very big issue, according to me, in our communities.
Anybody else would like to say anything about, because I think this is so much cultural.
So there's 2 ways to this. Where Nina's saying that the parents can be quite controlling, where I've come across a family where the child was controlling.
Oh.
So I found the child to be very controlling.
How old was he?
So, well, he's not a child, he's
Teenager.
Yeah, about 17, 18, I think. But the mother was, because he was very temperamental, so the mother was very scared to say anything to him. Just try to keep him calm all the time, or he'll totally lose it. So, there's always 2 sides.
Coming back to Nasima, I think, she's right. I think the parents are worried as well that they need to listen to the child, or they don't want to upset them, or they don't know how to deal with it, or how to set the boundaries. So if you have autism, I mean, you have to have boundaries. They need to know, or they have to have a routine. But the parents that don't have the knowledge or awareness, they're just scared, and they will just go ahead and do what the child wants to please them. One thing I'd like to say is I don't think there is much support within families. So if you, like a family that I've been working with, if you've got a child who's non-verbal or they've got behavior issues, the family doesn't understand it's due to a reason it's autism. What they think is they don't actually want to help look after that child. The mother needs a break, but the families are not coming forward to help the mother take a break or look after the child because they find it challenging, they don't know how to deal with it. So there really isn't that much support there. Or there isn't many organizations that help the mothers or take the child away for a wee break or take them away. I mean,
Nanaji, when Nazia was talking about family dynamics, so I just wanted to say, if there's an autistic child or an adult in the family, the whole family dynamic is affected, whether it's a mother or father. It starts with, for example, a mother recognizes his child is autistic. In order to get the support from a husband, it's very difficult. You need to make your husband or your partner realize that there's a condition among a child or maybe an adult. When the husband or a partner recognize, you have to make your whole family, extended family realize. So there is kind of denial that's going on because they don't want to see a child or a family member being labeled as autistic.
Also, the first point of contact, I would say, within the family is mother.
Yeah.
And we have to accept that we have patriarchal society or community we live in where men seem to be in charge, although mother is the first point of contact. And then there could be conflict between mother and father. And South Asian families, we do have a culture of extended family. And mother becomes, although she's the first point of contact, but she becomes the last decision maker for everything. So that is family dynamic. What about, are there any support networks within our South Asian communities?
No.
I don't think there is anything. I don't think people felt. For example, when we were trying to take the autism group for lunch, and one client, it was so difficult. They had autism within the family, and I tried to convince them to come. They're quite happy, they're quite vocal, talking in groups, but just because I said there's a group going and it'll be all mothers coming and discussing, or autistic adults coming having conversation, just didn't want to be part of it, just didn't want to be acknowledged, didn't want people to know. So there's a big thing that they don't want to come out, and this is what we need to really push for.
Yeah, because there are so many hidden cultural issues, religious beliefs, spiritual beliefs. How can cultural sensitivity be improved within healthcare? I mean, mainstream healthcare services. How can they pick up on these cultural issues?
Well, I think within the healthcare, people need to understand the cultural barriers, and they need to network with organizations like ourselves. Also, they need to employ people from ethnic minority who understand the cultural background and the stigmas, so they have a better understanding. And also, they need to have leaflets translated in native languages to help individuals.
I would like to just put it to all staff team that when it comes to improving healthcare services and providing cultural sensitive services, voluntary sector, community organizations seem to play a significant and very important role. Do you all agree with me?
Absolutely. And I think voluntary sector act as a bridge of connecting two main parties together. And it is very important for the bigger organization to get involved with voluntaries for this project like NKS. We became the mediator for the families and the organization alike, providing them the support that they needed. So this kind of in collaboration or interaction is needed.
I mean, the current project which we are running, we are doing awareness raising, education, so outreaching communities. Now we'll start with Nasima in Bangladeshi community. How are you outreaching and how are you taking this education to them?
It's proving really difficult. So I cannot go into someone's house for a home visit and say, I'm here because I'm doing this project on autism. So questions are going to be raised. So why? We don't have anybody with autism in our house. So I'm having to be very tactful, saying that, there's a new project we're starting and we're just raising awareness. I'm not saying there's anybody in your house who's autistic. I just want you to let you know that this is the condition and this is how a child is, or an adult. And if you need help, this is where I am. You can contact me. Me and Nazia, we're also visiting mosques. And when there's a group of ladies in the mosque, we're going to raise awareness that this is what we're doing and these are the symptoms. So if you feel that you need our help, we're there to help you.
Yeah, because addressing within our communities issue of autism, it's sort of any issue, because I remember once many years ago, we had a seminar on depression and we were sending out leaflets to people. In those days, we used to send leaflets by post. And then I get a phone call from one woman and she actually shouted at me on the phone. She said, "How dare you send me this leaflet? Do you think I'm depressed? Do you think I have depression problem? That's why you're sending it to me." So it's very complicated. But I would say that community organization, they are so closer to communities. When addressing issues such as autism, raising awareness, we do play a very big part to address these challenges. Now, as addressing these challenges, barriers within our communities, how is NKS and our staff team autism addressing this in the community? Let's go through it step by step. How do we outreach communities? Do we do open day? Do we do leaflets? Let's go step by step. Now, say for example, Nina, how are you outreaching community and convincing them to come and attend awareness sessions?
It's very hard, as Nasima said. But me and Rana, we made some home visits. But it's very difficult to tell them, first of all, why I'm here. Even though you know the people very well, but if you touch them, anything like autism or any other condition, they will stop back. Oh, what do you mean by that? The reason is, so as Nasima said, we tell them, we are here to talk to you. This is a project NKS is starting, and give them the leaflet. And if you need any help or support, we are here to help you. And important to talk to the men as well, because they're also a difficult part of our culture.
Yeah, and as I understand that we did organize two groups, one of young men and one of mixed one with carers and adults who are autistic. So how did you manage to do that? Shall we?
Well, I would say for first, what I've noticed is we can't go around saying, let's have a group just to have the autistic adults together. So what we did to begin with, we've already got 8 groups running. So what we did was to raise awareness. We did sessions within those groups, just about looking at, because our project is science and autism in adults. We obviously did the science, and then we did an engaging and interactive session where people could have a conversation. By having conversations, people could ask questions, but not for themselves. They could ask as a third party. Even though they might have autistic adults in their own home, or they might be autistic, but they might not want to be acknowledged. So we made it easy for them to ask us questions. Oh, of so and so I know this. Oh, they've got that. And it's like, oh, it's okay. You can come speak to us one-to-one if you need any help. I did it that way, which was really good because we identified some people through those groups that came to us one by one, and then they said to her, actually, I think so-and-so is autistic. Actually, my son is autistic, and what help can you give us? So that way we identified them, and that's how we did our outreach work as well.
Yeah, because, I agree with Nazia. This is also kind of a cultural norm within South Asian communities because we are not confident enough to come out in public or among a group of friends or whatever to say that I have an issue. It's nothing to do with autism. It could be anything. It could be domestic violence. It could be economic situation, social situation. It could be anything. We always, when we want information or when we want to deal with it and ask questions about it, we'll always say, my friend has an issue. We'll never say, I have an issue. So that is a big thing in our communities. Now, also, as Nina was saying, that Nina got a group of young men together and brought them together for this. Now, the way Nina explained to me is that, she took one young man in confidence and then worked with him to bring some of his friends who are autistic and convinced them, took them out for lunch, and had very comfortable environment where they felt totally comfortable to talk about anything among themselves. So that was one approach. Now, how did you do a structured approach like you talked about?
Yes, like whenever we used to have a visit or we were planning to go on a visit, we all used to have a brief conversation, like how to approach the person or how to approach the family. If the person was not comfortable for meeting us, we used to postpone the meeting or delay the meeting. And if the person was triggered, was not comfortable, we used to stop the meeting then and there. So this is such a sensitive topic. When you just spoke about, domestic violence, they don't want to come up. But I think, Nana, for all the conditions, there is an awareness, some kind of awareness. But when it comes to disorders like autism and other mental disorder, the awareness is not there. So we have to be extra cautious when we are approaching the families.
The whole thing is very, very complicated. I mean, as NKS, we are raising awareness generally in groups. We are targeting people, but I know when you ran these two groups, you took them out for lunch, you created a very comfortable environment, but the feedback, Nazia, we got in the end was excellent. And I think we managed to achieve some of our outcomes, which is very satisfying for us, because you tell what the feedback was rather than me.
I think the feedback was really good, because what I got back from the mothers that brought the autistic adults with them, they were saying that how difficult it is for them to make friends. But we had managed to have two adults make friends there, and how they decided to go bowling, and the mothers wanted to share information with each other and learn from each other, and then have more social outings, because that this was a really good way of networking, and they would like to have more sessions like this, more get-togethers where they can openly share lived experiences.
Yeah, peer support was a big thing as I read this feedback from the groups, because they very actively wanted a support group where they can, a platform where they can get together and, share information with each other. Now, even though it's a very short project and we have just touched the I would say the little bit of it, but it's a misconception. Yes, people, autistic adults, they don't make friends easily. But when we set up these groups, Rana will tell us, what the outcome was.
So now, Nanaji, it happened like when we took the mixed group out. So usually the autistic people, they don't have much friends. Usually they live in isolation, loneliness. So on that day, there were 3 persons who exchanged numbers, and I heard them talking, let's meet on the particular day for a coffee, or let's go for a movie. So that, I think, organization like us act as a bridge, and even if the support is delayed, we kind of give an intermediary support to them. So that was, I think, was a win-win situation for both the families and organization alike.
Excellent. I think this really is a big achievement for us as an organization, that we have managed to crack into one barrier and brought these people together. The feedback is they want peer support, they want a platform, and then how they are exchanging numbers and increasing their social networks. It's really, really important. But yes, this is us as community organizations. Now, when it comes to diagnosis, we already have cultural barriers because people don't go for diagnosis. Now, diagnosis services are very, very complicated. They're very inaccessible. How are you networking with organizations, and what is their take on it? Anybody wants to say?
Very difficult to get the autism diagnosis. I mean, as far as I know, there is only one organization that does the diagnosis, and that's Autism Initiative. But to go through the process, you have to go to your GP first, then your GP has to do a referral to CAMHS, then CAMHS has to do a referral to the Autism Initiative to be diagnosed. But the only thing is, there's a big long waiting list. I think it might be up to 4 or 5 years for CAMHS. So that's a lot of people don't get the diagnosis. I have been speaking to Autism Initiative, and I have tried to get somebody diagnosed, and they wouldn't accept the third party referral. They wouldn't accept the referral, so I had to go through. They advised me to go through that route, which I know is difficult. Although they do say there's a lot of help available. Once I've been speaking to other organizations, they are saying there is help available. You don't need to have the diagnosis, but then they've got things that you can come online, but if people are already struggling because of the cultural barriers and the language issues, how are they going to go online and seek help?
And there are digital
Yeah.
low literacy
Yeah,
as well.
exactly. And so it's very difficult for people to actually get the help. And then again, I don't believe if you don't have a diagnosis, that help is available, because I've heard people saying that they're struggling not getting help in colleges, universities, because they need that diagnosis.
Can I just add to that? I have a client who he started going to college, so he didn't get his full diagnosis, but it's known because he's gone through the process. They know that he is autistic. Now he's in college, he has no help in place, and what he was telling us is he struggles because there's a lot of things in writing. He does is it cooking.
Yeah.
So everything, all the instructions are in writing, exams are in writing, and obviously he's autistic. He finds it very difficult to read, concentrate, take it all in, and then answer the questions. So for him, if for someone like us, it'll probably take an hour to complete the paper. For him, it's going to take 3, maybe 4 hours. And this is where he stresses, because there's absolutely no recognition that he's autistic, no support in place.
And,
And
also
if anything, he felt at times when he's been giving instructions to do certain things and he can't do it right because he's processing what's been said to him, he gets shouted at by the tutor.
I know it's very difficult. I know that as an organization, we have tried connecting and networking with different organizations who work in this area of autism, but they are struggling themselves, these organizations. Now, what we can do is, I would like to bring in a mother who is going to talk about her experiences because her child is autistic and what is her experience of as a service user. Now, Tateer Fatima, here we have a mother whose child is autistic, and she would like to talk about her experiences. Do you want to introduce yourself and tell us a little bit how you're dealing with the situation and what your experience is?
Yeah, my name is Tateer Fatima, and my son had diagnosed with autism 3 years back when he was 3.5. He had language issues. He couldn't speak initially, and I had to struggle really hard to approach the speech therapist initially, and got.
If you speak a little bit louder, so that we can.
So initially, the speech therapist appointment was quite late, which was almost 4 to 5 months waiting list, and then I had to follow up because I was new in the country and I didn't know where to go, how to seek help, but I knew that there is something wrong, and with my the health visitor of my son, she really helped me. So in P1 he got some quite good support, but P2 the support has been eliminated because they think that he doesn't need that support. So in my opinion, he needs that support for his speech. So I found really difficult in mainstream to get the speech therapist. I had to go privately, and when I found the private sessions, it was 1,100 a session. And if I add on his reading skills or some other skills, it would go more than 1,500 or 1,500 pounds. So I couldn't afford that. But I heard from some of the parents in the network that the sessions are really good, the private ones, and they really improve kids. But I'm helpless because I can't afford that much of funding or finances. So in the mainstream or through government, there is no such kind of support for age 6 or above.
So basically what you're saying is that the services are very complicated, inaccessible, already parents are anxious, they are suffering because of as carers, and the child or adult is also facing difficulties, but on top of that the services are so inaccessible, so complicated, there is huge bureaucracy there. So anybody else would like to see Seema talked about this young man in college. Do you, Rana or Nina, have any experience of that when you were dealing with communities?
Yes, Nanaji, when we were conducting men's group awareness session, talking about what autism is, what are the signs to look out for, the denial mode when you're discussing so many things. The main thing is denial. I saw from the body language from the men's over there that half of them, they were just taken aback what we were talking about, and one of them literally said while he was leaving, he said, if it is a disorder, why don't you go to the doctor? He will give you a pill and get it corrected. So that was, I was that time taken aback as a worker. When you try to create awareness, people have they have shut down. They don't want to open the door of the knowledge to grasp what it is. So that was an experience for me.
See, there are issues of lack of understanding. On top of them, the services are so complicated. It's a huge process you have to go through. I would say that community organizations are acting as good mediators between mainstream services and communities, and we can raise awareness not only in communities, we can also raise awareness among service providers, how we can address these cultural barriers, how we can address this lack of information or any other barriers the communities have.
One thing we had to emphasize more on, Nina, is with autism, we've always stressed that it's an ability. Always look at it as an ability, not a disability, not a disadvantage.
Yeah. So we have to be very careful. This is a sensitive issue. So we will have to, I would say that we have only touched the topic in 6 months. And as listening to a mother, how it was difficult for her to access those services, and privately it's so expensive, I feel that, that this project has to continue. We have to continue dealing with the issue of autism in communities. We have to. What I would like to say is, I would like to summarize the whole thing is that what is generally, in simple words, autism is, people who are autistic, they find it hard to understand with what others are thinking and feeling, getting very anxious about social situations, finding it hard to make friends, or preferring to be on their own, seeming blunt, rude, and not interested in others without meaning to. Actually, they don't mean to do all this, but autism changes their behavior. These are the behavior symptoms, you'll see. I would like to say that community organizations are really, really important, play a crucial role in raising awareness of complicated issues and actually acting as mediators between communities and community organizations. We can raise awareness in communities, we can raise awareness among service providers of the barriers, and we can help address these barriers in communities. Now, in the end, I would like to say that if you know anybody or if you would like to have more information about autism, please get in touch with NKS. And otherwise as well, thanks for watching this session, and any information you want, come to NKS, which is through this YouTube channel, which is, you should subscribe to this, which is Networking Key Services, the name of the YouTube channel, and we will continue to provide more and more information about different projects and different topics here. Thank you.
Please subscribe to our channel and like, comment and share. Thank you.